Recording. Before we begin, are there any questions? I did get some grading done, not as much as I was hoping to over Thanksgiving weekend, but I did get some grading done. So take a look at the grade book. Another thing, question?
I did have a quick question.
Uh-huh.
Regarding the quiz tomorrow in the grade book, it says it's only worth 0.24 points. Is
Yeah,
that
if
right?
you go into the quiz, you'll find that there's a note there saying that I've done that on purpose because one of the quizzes are going to be tossed out. And if I put the full points in the grade book, then your grade will be inflated,
Okay, that makes sense.
75 points. So I've got one of the quizzes graded. It's not quite zero, but it's close to zero to keep your grade essentially correct if you take the quiz.
Okay.
Okay. And then I'll go in and manually remove your lowest quiz, and that'll be in the drop quiz column. And we'll change quiz 5 to be worth the total amount, which would be 75 points. So no, it's worth 75 points, the same as all the other quizzes. I just don't want your grade to be inflated because that would give you 75 additional points, which is enough to make most people go up one grade. Okay, so that's why I don't have it that way. The other thing I need to warn you about on quiz 5, let me see if I can find it. And that is, it is not in the grade book. I can't show you the grade book. I almost did that. Boy, that would be a mistake to show you the grades of everyone. You can't find it in the grade book. You can, however, find it under week 10 lecture and lab, quiz 5. It does require Respondus lockdown browser. In this one, there is no quiz 5A, so all of them are multiple choice questions. So to get this quiz, you need to access it from this page. I just put it right before class in the calendar, so you can see quiz 5 being in the calendar to remind you. But if you go in the grade book, you will not find quiz 5. And that's because it's actually, I designed it as a practice quiz to make it worth only 0.24 points. And then I'll manually change it in quiz 5C, which is in the grade book, although you might not see it yet. And that will bring up the points to 75 points. Any question about that? And practice,
No, but I see it in my grade book.
you see quiz 5 or
Yeah.
quiz 5C?
Quiz 5, quiz B is what it says. Quiz 5 requires lockdown browser, quiz B.
I think I better look into that. That might not be supposed to be there. Let me stop sharing my screen. Go to the quizzes. I'll go to the grade book. I see quiz 4C and then quiz 5C, which is unpublished, so you can't see that. Let me scroll way over here. I don't see quiz 5B in my grade book. Can you tell me where? Oh, wait a minute, there's quiz 5. Quiz 5 is in the grade book. It's way at the very end. But quiz 5B, you're saying?
That's what it says. It says,
Where is
yeah.
quiz 5B?
It's right towards on my grade page. It's towards the bottom, right above unknown notes.
Um,
In my grade sheet.
all right, you're not seeing it the same way I am. You're seeing it horizontally. I'm seeing it vertically. Unknown notes. I'll go look near unknown notes. Yeah, there's quiz 5. It is showing in the grade book. It's just at the very end. But I don't see a quiz 5B. Let me go into the quizzes. And I think quiz 5B I should unpublish because I don't think you're going to be taking that one. Let me see how to get there. Get out of the grade book. Go into the quizzes. I don't even have a quiz 5B in my grade book. You sure it's quiz 5B?
Yeah, it just says it says quiz 5, and then requires the respondent's lockdown browser, and then underneath it just says quiz B
Oh, so it's
on
quiz
the
5.
screen.
Is what
Quiz
it says
5,
on
yeah, but
top.
then
Okay. Quiz 5, and how many points is it worth?
0.24.
Yeah, that's the correct one. All right.
Okay.
Yeah. That is in your grade book. It's at the end of my grade book. That's why I didn't find it. I didn't think it was in the grade book. I'll try and move it with the other quizzes, which I don't know if that moves it for you or not, but all right. Let's get to the class. Let me get back to Zoom and start sharing my screen, make sure I'm out of the quizzes and the grade book. I shut down the quizzes. Share my screen. Should be seeing my screen now. So it is in the grade book, but it's not with the other quizzes, at least in my grade book. All right, so we're supposed to be finishing chapter 14 today. Today is November 28th. Do note there is a quiz 5, which you should take on, well, 11:59 p.m. tonight to 11:59 p.m. tomorrow night. It'll cover chapter 8 and lab 9, so this will be the most narrow quiz, covering only those two topics. You should be working on your unknown project. Your unknown notes is going to close Friday, December 1st. The unknown project is due Saturday, December 2nd, and that'll be your unknown report. Any question about any of that? There will be no lab anytime this week. I will show up for the first 15 minutes of lab on Tuesday to answer any questions, but after 15 minutes, I'll log out.
I had a question. I'm a little confused with the unknown notes because it only lets me submit one assignment. So it's not like I can just go in there and put a note in and then come back later and put another note.
Are you the person I answered with the email? I
Um,
answered someone and I told you if you're getting confused with the unknown notes, what you want to do is copy your existing page and then put it at the top of your new unknown notes page. Okay?
okay,
That
so
way you
basically
just
just
build
put
up
it all
the,
into one assignment.
uh, yes, what you'll do is you'll just have multiple unknown notes pages and you'll just keep it all in one page. And that way you can see all of them at once. You can, if you go into the unknown notes page, let me go to a previous term. Oh, come on, scroll up. You can, because I don't want to show somebody else's screen here. Oh, let's go to the dashboard. Summer 2022. About week 5 lab. To get to the other unknown notes pages, all you have to do is come up to this button here and change it to look at whatever day you want. But you can, like I said, copy all of this page. Let's go to the 4th. Copy all of this page. Just highlight it all and copy it. And then on your new page, put it on the new page. Put it at the top of the new page. Keep it in order.
Okay.
Okay. But you are only supposed to request one test at a time. And somebody put in a whole bunch of days, 1, 2, 3, although they were much closer, like a day off, putting in a test for day 1, a test for day 2, a test for day 3. When I go in and look at it, I'm only going to see your most recent submission. So I'll send you the test for your most recent submission. And anything before that, I'm just going to ignore, assuming that you decided to change your mind and that you put in a new submission. Okay? All
Okay.
right. Oops, I'm showing somebody. Sorry about that. If that's somebody. No, this is summer, not a big deal. Nope, I'm still in it. Hopefully I didn't shut something down that I didn't mean to. All right, so, oops, I'm still in the wrong thing. There's the right page. All right. So let's go back to the syllabus. I think we're done. Let's move to chapter 14. And we talked about Cox postulates last time and stated there are exceptions to Cox postulates. Like if you can't get the cells to grow in tissue culture, or it would be morally or unethical to give the disease-causing organism to a patient. In classifying infectious diseases, a symptom is a change in a body function that is experienced by a person as a result of a disease. However, this is subjective, and that is only that person can know they have that symptom. There is no way to measure the symptom. Like when somebody has a headache, nobody else can know that the other person has a headache. Only the person who has it. There's no way for it to be apparent to an observer. A sign, on the other hand, is a change in the body that can be measured or observed as a result of a disease. So this is an objective classifications measurement, such as somebody who has a temperature of 38.5 degrees Celsius, and I don't know what that is. Let's just say it's 102, 103 degrees Fahrenheit. That can be easily measured. So a sign is something that can be measured, and anybody can test it. A syndrome is a specific group of signs or symptoms that are characterize a disease, such as the signs and symptoms that are characteristics of AIDS. Any question about any of that? A communicable disease is any disease that is spread from one host to another. Examples: measles, tuberculosis, and chickenpox. So these diseases can spread from one person to another. A contagious disease is a disease that is easily spread from one host to another. An example of a contagious disease is the human cold or the flu. What is a communicable disease which is not contagious? Because all contagious diseases are communicable, but not all communicable diseases are contagious. What of these 3 communicable diseases is not contagious? Anyone know anything about measles? How easily does it spread from child to child or unvaccinated adult to adult?
Very easy.
Yeah, it's definitely contagious. And how about chickenpox? You know, chickenpox isn't a good example anymore because it used to be 95% of Americans got it, usually in childhood. So that tells you how easily it spread, I guess. But today, because of the vaccine, it's actually a rare disease. So the point is, it does spread very easily. So it is a contagious disease. Does anyone know anything about tuberculosis? How easily does it spread?
It's
Well,
kind
it
of
can be latent or not latent.
Yeah, that's not telling me how easy it spreads. That's telling me whether it's latent or not latent.
it spreads really easy.
No, it doesn't. You
Oh,
need
it doesn't?
long-term exposure to TB to get tuberculosis. It can spread. I'm not saying it doesn't. Gosh, I used to show a movie where there was somebody coming into a room full of patients who were prisoners and they all had a drug-resistant form of tuberculosis. And the doctor, I think, was from the West, and he was going to offer them, the patients who wanted it, a drug that was for treating drug-resistant tuberculosis. And he was in the room without a mask. And the reason was he wanted the patients to feel comfortable and take the treatment. And he thought the best way to do that would be to not wear a mask. And he reasoned that tuberculosis doesn't spread easily. He kept his distance from them too to help out. But my point is that tuberculosis does not spread easily. It does usually require long-term exposure. That doesn't mean you cannot get it just by a brief exposure, because there's always an exception. Okay, but usually it takes long-term exposure, so we don't consider it contagious, but it is communicable. Another example of a communicable disease that is not contagious is, just a minute, I'm trying to remember the name of it. The biblical disease that caused flesh rotting, and it's oh, it starts with an M, I think. No, it's not malaria. Ah, unclean person is a person carrying what disease? Oh gosh, nobody's stating, nobody knows, not me.
Is it leprosy?
Leprosy. I didn't get it right. I was thinking it starts with an M, but it's leprosy. Yeah, leprosy is a disease which is communicable because it can spread, but it does require long-term exposure. And it's not contagious for a number of reasons, mainly that it requires long-term exposure to get it. And then only about 5 to 10% of the population can actually get the disease. So that's an even better example. A non-communicable disease is a disease that does not normally spread from one host to another. Examples of that would be tetanus or Rhinobacterium diphtheria. Is that right? No, that's not right. Botulism, sorry, botulism. Diphtheria can spread from one patient to another. Botulism does not normally spread from one patient to another. How you get botulism is you eat the spores of the botulism bacteria, and then it grows in you, which produces an endotoxin, causing the botulism. So the only way to get it to spread would be if you were to eat someone who had botulism and then you didn't cook them well. Okay? So it does not normally spread, and we call those non-communicable diseases, diseases that do not spread. Tetanus, you usually get it from a puncture wound, like stepping on a nail. Another way of talking about disease is to look at the occurrence of a disease. To understand the full scope of disease, we need details about its occurrence. The incidence is the fraction of a population that contracts a disease during a specific time. The incidence is only looking at the new cases. The prevalence is the fraction of a population having a specific disease at a given time. So the prevalence is looking at the new cases and the old cases. Like usually when people are talking about COVID-19, they're giving the numbers of the prevalence. An example of incidence and prevalence in 2007 in the United States, there were 56,300 new cases of AIDS. So that would be the incidence. But in 2007, the prevalence of AIDS was 1,185,000. So that was looking at both the new cases in 2007 and then everybody who had AIDS up until that point in the United States. Any question about that? And I believe the prevalence is only talking about the people who are still alive. A sporadic disease is a disease that occurs only occasionally in a population. Like typhoid fever, some people say it's a sporadic disease in the United States. Some people even call tuberculosis a sporadic disease in the United States. An endemic disease is a disease that is constantly present in a population. Like malaria is endemic to the tropics. The common cold is endemic in the actually in the world, any place in the world, because it's just endemic in the planet Earth. An epidemic is a disease acquired by many hosts in a short period of time. Usually, an epidemic is on one continent. An epidemic is also usually defined as significantly higher numbers than expected. Like right now, you could say we in the United States are in an epidemic of COVID-19. However, it's actually a pandemic, and I'll explain the difference in a minute. Because it's significantly higher than it was before. When was that? 2000, 2001, something. No, not 2000, 2000 or 2020 or 2021. It's 2020 when it first hit the United States. That's right. So this winter, will we have an epidemic in the United States of influenza? And the question is, will the flu be significantly higher than normal winters? If it is, it would be an epidemic. If it's not, it's just the flu season. And yes, there is cases of flus, but they don't usually call it an epidemic. Any question about that? All right, a pandemic is where more than one continent has an epidemic of a disease. Like right now, we're in a pandemic for COVID-19 because before 2019, the expected incidence of COVID-19 was 0 because the disease was not known and had never hit the human population before. And we know that because it's a new disease that recently formed by several viruses getting together. And we'll talk a little bit about that when we talk about viruses. Any question about any of that? So usually when something starts as an epidemic, like COVID-19 started in China, so in Asia, they had an epidemic, but once it spreads beyond that continent, we then call it a pandemic. And pandemics usually become worldwide because they spread so easily. Any question about any of that? Now, when you have rare cases like tuberculosis in the United States, it becomes an argument. Is it a sporadic disease or is tuberculosis endemic in the United States? Because it's rare cases of an endemic disease. And that is, some people say, well, tuberculosis is always found in the United States, so it's endemic. You just go out to the homeless population and sample them, you'll get tuberculosis. And other people say, no, it's a rare disease, so it's sporadic. And we're not going to talk about the rare cases and argue about whether it's sporadic or endemic. Any question about any of that? Another way of talking about disease is talking about the severity or duration of a disease. It's a very useful way of defining the scope of disease is in terms of its severity or duration. An acute disease is a disease where the symptoms develop rapidly. The disease is short-lived, and then the disease goes away. The best example would be the human cold. The disease develops rapidly, it's short-lived, and then it goes away. Another example would be the flu. It does develop rapidly. It's relatively short-lived. Obviously, depends what you define by short-lived. And then it does go away for the patient who is sick with it. A chronic disease, on the other hand, is a disease that develops slowly. It usually gets worse with time, and it persists for long periods of time. An example of a chronic disease would be mononucleosis, also called the kissing disease, and hepatitis B, when you get liver cirrhosis out of hepatitis B. Any question about any of that? Now, you can have diseases in between an acute disease and a chronic disease. We're not going to talk about them. A subacute disease, symptoms between acute and chronic. I'm sure you've never heard of subacute sclerosing panencephalitis. So we won't talk about it, and you won't be quizzed on it either. Another way of talking about disease is to talk about the extent of the host involvement. Infections can be classified according to the extent to which the host body is affected. A local infection is where the host has a pathogen limited to only a small area of the body, such as a boil on the skin, a localized infection of the skin, or an abscess. So this is a local infection. And if it goes further, like the boil, as the bacteria invade the bloodstream and the bloodstream carries it throughout the body, that will become a systemic or a generalized infection, an infection that spreads throughout the body. Some diseases are systemic, like measles. It goes essentially everywhere in the body. You can have a focal infection where a systemic infection began as a local infection, such as MRSA. It begins on the skin, usually as a boil or a skin disease. And if it invades deeper, it will get into the blood and then be spread to the blood, becoming a systemic infection. Any question about any of those? Bacteremia is the presence of bacteria in the blood. When a clinician finds bacteria in the blood, they will usually classify it as bacteremia because clinicians usually don't have the capability of classifying it as septicemia. Septicemia is actually when there's bacteria in the blood, but the bacteria are growing. So you have to do further tests to make sure that the bacteria are actually growing in the blood. And here we're looking at a picture of septicemia, right here and here. Toxemia, the presence of toxins in the blood. Viremia, the presence of viruses in the blood. Any question about any of that? The state of the host resistance also determines the extent of an infection, meaning a host can be more resistant to a disease, especially younger, healthy people. They're more resistant than older or sick people. A primary infection is an acute infection that causes initial illness. So when you first come down with a sore throat, that would be your primary infection. A secondary infection is an opportunistic infection after a primary infection predisposes the patient to getting a second disease-causing organism causing another disease. So the secondary infection requires a primary infection to weaken the host, either their immune system or to damage the mucosal membrane or the skin to allow infection by another agent. And that agent is usually a nosocomial infective agent, meaning what's the word I'm looking for? A part of your normal microbiota. And that's why we call it opportunistic. A case of secondary infection would be the child gets a cold, the primary infection, and then the secondary infection is they get an earache from bacteria growing in the ear. So the bacteria in the ear causes the secondary infection. And the human cold is caused by a virus, obviously, the primary infection. Any question about that? A subclinical disease we've talked about before, but we didn't call it a subclinical disease. We called it an asymptomatic disease. A disease where the patient has no noticeable signs or symptoms. You could call that an inapparent infection. The trouble with subclinical diseases or an asymptomatic disease is the patient doesn't know they're carrying the disease-carrying organism, and then they can carry that disease to a more susceptible patient, like the patient's grandparents, and then they come down with the disease and it's not subclinical. It could be life-threatening, such as COVID-19. Most of you are young, if not all of you, and in COVID-19, for young, healthy adults, as well as children, 50% of the patients will be asymptomatic or subclinical. And then you can carry that to your grandparents or some other elderly individual, and it will not be asymptomatic. It could be life-threatening in them. Any question about any of that? All right, I do have a note here that some people can carry polio virus and they never get signs or symptoms of polio. That means they can spread it to other people. Polio we'll talk about in a little bit in our next lesson. I think there's only 2 or 3 countries in the world that currently have the polio virus. The United Nations has been trying to make polio an extinct disease in the United States by making the virus extinct. And it started actually because of a doctor in Latin America, especially South America, wanting to make polio extinct in Latin America. And he reasoned he could do it because the first world countries essentially had polio extinct. In fact, in the United States, the only way that anyone ever brings in polio is they go out of the country, pick it up in one of the other places in the world where it's coming from and bring it back to the United States. And that's very few people that do that. I'm not sure when the last case was that we had polio in the United States, but it's not every year. In fact, it's probably seldom. Any question about any of that? All right, a latent disease is a disease where the patient goes through a period with no signs or symptoms. The pathogen becomes inactive and doesn't cause disease. Usually when the pathogen is latent, the pathogen is not reproducing. It's just sitting around waiting to come out of latency, where it will actively divide, cause the host problems, and then cause disease. A good example of a latent disease is the shingles. A child comes down with chickenpox, and this is something that happened to about 95% of children when I was a child. In fact, it happened all the way up until sometime in the 1980s, which is long after I was a child, at least 20 years. And the child comes down with chickenpox, and then the chickenpox goes away, but the virus is still present in the child. And it's just sitting around in a latent stage, not doing anything really except for sitting. And then much later on, usually when the child is now a grandparent, it can come out of latency, the virus, and then cause the shingles. Another case of a latent disease is herpes simplex type 1, which causes cold sores. And when you have a cold sore, herpes simplex virus type 1 is actively replicating, causing the cold sore, and can spread, by the way. And then it'll go into latency, and it depends on the patient. Frequently, it'll go into latency for a year or longer for cold sores. I haven't had a cold sore now for several years. It can come out of latency usually by a trigger. We'll talk about that in the next lesson. And the trigger for the cold sore is frequently a patient comes down with a cold. That's why it's called the cold sore. Any questions about any of that? All right, herd immunity is where many people in the population are immune, and so the disease cannot spread in the population, and the non-immunized people are protected because of the immune people. Let me see if I can blow this up. So initially, everyone is susceptible. 2 people who are in red have come down with disease. The disease will then spread from one patient to another, essentially getting most of the population. And they're afraid this is going to happen with COVID-19 when it first came out. If, on the other hand, you have immunity, most of the people are immune, then when the people who are in red come down with disease, only those people who are in close proximity to those who are diseased and who are non-immunized, meaning the blue people, non-immunized, susceptible hosts, come down with the disease, but the other people are protected because this disease has to go from the infected patient to that patient to that patient. This patient is immune, so it can't spread to them. And then this patient is never exposed to the disease-causing organism. This is the point of vaccinating the population to get the vaccination high enough to create herd immunity. For the case of measles, you need 95% of children or the population to be vaccinated to stop the spread of the measles. Less than 95%, the measles will continue to spread. And every once in a while in the United States, we have epidemic of measles because parents say, oh, the measles doesn't happen very much anymore. I'm not going to bother getting my child vaccinated, or I don't believe in vaccines, so I'm not going to vaccinate my child. And then the measles hits and then it spreads, usually in the United States, just in a couple of cities in, I think it's a winter. I'm not sure when the last case of that was, but it happens every few years because you need the vaccination to be very high to stop the spread of the measles. COVID-19, initially the vaccination level had to be 85%. I think because COVID-19 spreads more easily now, I imagine the vaccination level needs to be 90% to prevent the spread of COVID-19. There's no way that the United States will ever get 90% of the people taking the vaccine to COVID-19 to prevent the spread of COVID-19. So we'll be living with COVID-19 probably for the rest of our lives. Any question about any of that? What would be a good example? Well, a good example of herd immunity is when you have 90% or higher of the children vaccinated, and then the measles does not normally spread. All right, let's stop the show there. Let's talk about the patterns of disease. Normally, when a patient comes down with a disease, it follows a specific sequence of events associated with the infection by a microbe and then the subsequent forming of disease. So the first pattern that has to exist is the disease-causing organism has to come from somewhere, and that we call a reservoir. So a reservoir must exist where the disease came from. The pathogen must be transmitted to a susceptible host before somebody can come down with the disease. The pathogen has to invade the host and then multiply in the host. The pathogen further has to injure the host before we'll have signs and symptoms of disease. The illness then ends when the host immune system either destroys the pathogen or the host, the illness will end when the host dies. That will end the illness. Any question about any of that? There are predisposing factors that can make a body more susceptible to and therefore affect the occurrence of disease. So there are predisposing factors that make a person more likely to come down with disease, assuming they're exposed to the disease-causing organism. For example, females have a shorter urethra, and so they have a higher incidence of a urinary tract infection than males. But it doesn't matter what age group we look at. Boys have a much lower incidence of urinary tract infection than girls. However, even girls have a very low incidence of urinary tract infection. The people with the highest incidence of urinary tract infection are elderly women because they have the shorter urethra. They're elderly, so their immune system is weak. And then they're elderly, so their urine flow is weak, meaning they're not flushing out the pathogen from their urethra. And the pathogen is just moving its way up the urethra. Probably by locomotion, meaning the bacteria are swimming. Any question about any of that? Another predisposing factor can be inherited traits, like it's well known that sickle cell anemia patients are more likely to come down with essentially any illness because they're less resistant, more susceptible to coming down with illnesses. It's also true that diabetics, although that's not exactly one gene causing diabetes, but diabetics are predisposed to coming down with another illness. They're just more likely to come down with disease. The climate and weather, it's well known that colds and flus are more likely to hit in the wintertime, the colder weather. So climate and weather can be a predisposing factor. Fatigue is another predisposing factor. And this is one that college students should be aware of because they're frequently fatigued, either by studying too much and not getting enough sleep, or by partying too much and not getting enough sleep. Once you're fatigued, you're more likely to come down with disease-causing organism, causing the disease. Another thing is when you're sleeping, that's when your immune system is working its best, its strongest. And we'll talk a little bit more about that. If you're getting fatigued, your immune system's going to be weaker. Age is also a predisposing factor. It's well known that many diseases hit usually, let me see if I can draw that out, usually the very young and the very old. So most diseases, let's try and make a graph here. This is just time on the x-axis. I'm not going to put it here. The percentage on the y-axis. And most diseases hit the very young. And the very elderly. And so most diseases have this type of an occurrence. This isn't time, this is the age of the patient, sorry. That I should put on the graph. Like the incidence of colds and flus, more likely in children, especially very young children, more likely in elderly, especially if you're looking at serious disease. Well, colds aren't terribly serious, but this is the same as that. Let me think about another case. Oh, I almost had it. I think the mononucleosis has this sort of an incidence too. No, it doesn't. Actually, mononucleosis is more likely to happen to teenagers and young adults, but that's because they're kissing. Oh, well, I'm just going to leave it generic and say that's the case. I can say that with COVID-19, it's not quite like that. The very, very young have a higher incidence. Oops, don't have the right one on. Back home. The very young have a higher incidence, but then children have a very low incidence. And then adults, very young adults, very low incidence. And then the elderly have a very high incidence. And you'll note with COVID-19, the elderly, especially the extreme elderly at much greater risk than even infants, which have the highest risk. But this does follow that type of a pattern. It's just not as great. And it drops very rapidly. So that, I don't know, maybe age 1 or 2 is like around here. So it drops very low after about age 1 or 2 in children. But the newborns, COVID-19 is a risk. lifestyle can affect your incidence of getting disease, meaning it's a predisposing factor. It's well known that smokers are more likely to get respiratory diseases, and that's because their smoking habit damages their mucosal membranes in the upper respiratory tract, making them more susceptible to disease-causing organisms. And then chemotherapy, predisposing patients to getting a disease. Chemotherapy usually weakens the immune system, and then that makes it more likely a patient is going to come down with the disease, which will then be able to grow better, causing more problems for the patient. Any question about the predisposing factors causing disease? The development of disease normally follows a specific pattern. Once the host defenses are breached, disease follows this certain sequence, and the sequence tends to be similar for acute and chronic diseases. Before the patient gets infected, to when the patient is infected, to the time that they have the first signs or symptoms, we call that the incubation period. When the patient first becomes infected to when the patient first has signs or symptoms, it's called the incubation period. Let me blow this up. So on the x-axis is simply time. On the y-axis is both the number of microbes present in the patient, as well as the generally the illness of the patient. So the incubation period will be when the number of organisms is higher than 0 to when the number of organisms reach a threshold. And above that threshold, the patient now has signs or symptoms of disease. The next period is called the prodromal period, where the patient has mild signs or symptoms. Like when you first come down with a sore throat and you say, geez, am I coming down with a sore throat? And you stop and think about it. And you say, yeah, I do have a slight sore throat. That is the prodromal period. The period of illness is when the signs and symptoms are now severe. And it concludes when they're most severe. Like when you no longer have to stop and think if you have a sore throat, you know you have a sore throat. That's the period of illness. The period of illness is then followed by the period of decline, when the patient's signs and symptoms start getting better. For example, when the patient gets a fever, that's the period of illness. And then when the fever breaks, that starts the period of decline. Any question about any of that? The period of decline is followed by the period of convalescence. During the period of convalescence, the patient has no signs or symptoms of disease. They still have the disease-carrying organism in the period of convalescence. They just are below a threshold number of organisms or microbes causing disease, so the patient has no signs or symptoms of disease. And that will continue until the patient has no infective agents in them. After that, the patient is cured, which isn't on here. Any question about any of this? No questions. Well, here's a question for you. During what period is a patient not going to spread disease? The incubation period, the period of convalescence, the period of illness? Anyone have a guess?
Would it be incubation?
Actually, extremely early in the incubation period, you are correct, but late in the incubation period, you are not correct. The patient can spread disease late in the incubation period. For some common diseases of people, adults, I should say, of some common diseases of adults, the time when the patient is most contagious is actually late in the incubation period and early in the prodromal period. This would be especially for colds and flus and other diseases like that. The adults are most contagious late in incubation or in the prodromal period. And they're more contagious in the period of illness when the patient has more organisms, more microbes. The reason for that is the adult's immune system is ramping up. And in the period of illness, the immune system is attacking or preventing the microbes from leaving the patient and then going out and infecting another patient. However, late in the incubation period or in the prodromal period, the immune system hasn't ramped up to do that yet. And so in adults, when you first come down with the cold or the flu, you're most likely to spread it late in the incubation period or in the prodromal period. Any question about any of that? All right, that was a trick question. Actually, I haven't answered it yet. And that is, there's no period of disease that the patient cannot spread the disease. You can spread it late in the incubation period. You can spread it in the prodromal period. And as I mentioned, that's actually when adults are most likely to spread certain diseases like colds and flus. You can easily spread in the period of illness and in the period of decline. And what most people don't know is you can also spread it in the period of convalescence, because you do have the disease-carrying organism in the period of convalescence. However, you're less likely to spread it in the period of convalescence than most other periods, because first of all, the patient doesn't have very many organisms in the period of convalescence. And second, the immune system is ramping up, making it less likely that the patient will spread it in the period of convalescence. So it was a trick question. I won't ask any like that on the final, but it's well to know that you can spread disease in any period of illness. My mother would frequently tell me, "Oh, I'm better now. You can come over. I won't spread disease." And I would always tell her, "Mom, you're speaking to a microbiologist. I know better. You are," I don't know, in the period of illness, because she still had signs and symptoms. It's not period of illness, period of decline, because she still had signs or symptoms, but she was better. So she could spread disease. Any question about any of that? All right. I should mention that not all of the periods of disease occur with every organism. For example, one moment I was fine. I was in the incubation period. I had no signs or symptoms of disease. And then all of a sudden, it feels like somebody took a sledgehammer to my head. And sometimes that's how the flu hits you, where you're perfectly fine, the incubation period, then you skip the prodromal period, and it feels like somebody hits you over the head with a sledgehammer. The period of illness. There is no prodromal period, at least sometimes, if not most of the times for me, when coming down with the flu. And then there are also diseases where there is no period of decline or period of convalescence. That can be when the patient dies, like AIDS patients before modern medication, the patient would hit the period of disease and then they would die. There would be no period of decline or period of convalescence. Now, with modern medication, you can actually put AIDS into remission, so the patient still has HIV, but they can lose the signs and symptoms of AIDS. And that does have the period of decline. I think in most patients, it's no, some patients with modern medication with AIDS, they no longer have AIDS, so that would be the period of convalescence. When you get the cold and you go through the incubation period and then the prodroma period and then the period of illness, I have done this before. If you get lots of rest, you can actually boost your immune system and then skip the period of illness and the period of decline and move directly into the period of convalescence, where you have no signs or symptoms anymore of the cold. The trouble is with me, once I have no signs or symptoms of the cold, I stop getting lots of rest, and then I will overdo it, weaken my immune system because I'm not getting enough rest now. And then I get the signs or symptoms of the cold coming back. And I say, oops, I still got the cold virus. I need to get more sleep. And at least once I've done it where let's see, I went through the incubation period, the prodromal period, and I might have skipped the period of illness and the period of decline, got lots of sleep, moved it into the period of convalescence, got up, didn't get enough sleep, the cold came back on me, re-entered the prodromal period, and then probably entered the period of illness, got enough sleep, and then brought it back into the prodromal, the period of convalescence. With the human cold, you can do this. And like I said, if you get enough sleep, that's the best way to do it. You get lots of rest that boosts your immune system. You can knock the cold going from the prodromal period to the period of convalescence or the period of illness to the period of convalescence just by getting enough sleep. I've tried it several times on the flu and it doesn't work for the flu, but at least not for me. But with the human cold, you can get that to do, where you can move it to the period of convalescence. Any question about any of that? All right, let's talk about the spread of infection. The spread of infection has to come from a reservoir. A reservoir is a source of the infective agent. Disease comes from a reservoir. The reservoir can be living or non-living. Humans are a common reservoir, especially for human-only diseases like AIDS and gonorrhea. You can only get it from another human. Obviously, the first time AIDS came down, a person got it from a non-human, probably an ape or chimpanzee, and or a monkey or something. They used to know. One came from the chimp. I'm not sure where the other AIDS comes from, meaning there's two HIVs, and one did come from a chimp. I'm not sure about the second one. Don't remember. The carriers for human reservoirs may be inapparent infection, meaning asymptomatic carrier, or they could be somebody having latent disease. So human reservoirs are one source of disease. But there are also animal reservoirs where a patient comes down with the disease from getting it from an animal. There aren't too many cases of the flu coming from animals, except for maybe bird flu. But cats and dogs can get at least some types of the human flu, and then you can pick it up from them. A better example would be rabies and Lyme disease. These diseases only come from animals. We call these zoonoses, animal diseases that can be transmitted to humans. If you do not know, rabies is a disease you can only get from animals, because when a human gets rabies, the virus does not spread to another patient, meaning patient to patient. When rabies grows in a human, the rabies virus does not get into the saliva, and rabid humans don't have the urge to bite either. So there's no spreading of rabies in people, from people to people. You have to get it from an animal, meaning it's a true zoonotic disease. And in the dog and the cat and all the other animals that I'm aware of, the rabies virus does its damage in the nerves, so in the brain or the nerve system, and then the virus gets to the animal's salivary glands, and then when the animal bites another animal or a person, the rabies virus can spread. The third reservoir of infection is a non-living reservoir. We get some diseases from non-living reservoirs, for example, botulism, which you get from canned food, tetanus, which you get from a puncture wound, like stepping on a nail. Some examples of non-living reservoir would be the soil or the nail that you stepped on to get tetanus. The food, the canned food, which is no longer living because it's in a can, it's giving you botulism. Non-living reservoirs are frequently soil, water, or lettuce. Water, not in first world countries, but in third world countries. Any question about any of that? All right, let's talk about the transmission of disease. There are three principal routes by which a causative agent of disease can be transmitted from the reservoir of disease to a susceptible host. Three principal routes are contact transmission, so that somebody picks it up by contacting another person. Vehicle transmission, that is where an object brings the disease-carrying organism to you or to a patient, a host. And then there's vector transmission, where an animal brings you the disease-carrying organism. Any question about any of that? All right, let's talk about contact transmission. There are three types of contact transmission. There's direct contact, indirect contact, and droplet, which I guess is droplet contact. Direct contact is person-to-person transmission, requires close association between the infected person and the susceptible host. Direct contact transmission can be passed in a handshake, kissing, anything like that. So it spreads from one patient to another by direct contact. Indirect contact is where the disease-carrying organism comes out of the disease-carrying patient and moves on a non-living object that we call a fomite, and then the non-living object that we call a fomite carries the disease to a susceptible host. An example of this would be actually how many colds and flus spread. Somebody sneezes, gets the disease-carrying organism on their hand. They then touch a doorknob or a light switch, putting the disease-carrying organism on the doorknob or the light switch. Somebody else, who's a susceptible host, comes and then touches the doorknob or the host, and then they inoculate a mucous membrane in their face, meaning if you have the cold or the flu on your hands, and that's it won't spread. You won't get infected. You need to take it from your hands to a mucous membrane on your face. Example there, and I'm drawing a blank on what I wanted to talk about. I did mention that colds and flus tend to spread that way, where we actually pick it up on our hands, and then we inoculate a mucous membrane in our face, other than the ears usually. And then we pick it up that way. So the colds and the flus, if you were to get it on your hands and then wash or desanitize your hands, you will not get the colds or flu. Some common fomites that spread transmission of disease indirectly would include handling contaminated tissue, contaminated money, a contaminated ball. I'll go through some of those examples in a little bit. The third type of contact transmission is droplet transmission, and that is where the person coughs or sneezes or maybe sings, and then the airborne droplet is expelled, carrying the infective agent, and the droplet travels less than 1 meter. So from here to there is 1 meter, and this will be droplet transmission if you step through this area, or yeah, I just say you step through this area here. Any question about any of that? Direct contact transmission, when you touch somebody, high five, kissing. Indirect, if the baseball picks up the disease-carrying organism, and then the baseball is thrown to the catcher then touches the baseball with his hand, and usually will inoculate a mucous membrane in their face to get the disease. Very few organisms could spread through the skin of the hand. Any question about any of that? All right, vehicle transmission. Transmission by an inanimate reservoir, such as a cup, a glass, a light switch, a doorknob. Vehicle transmission can be spread by food, water, or body fluids. There are 3 types of vehicle transmission. Waterborne transmission. You drink contaminated water that's been contaminated by sewage, you can get a disease. This is happening most of the cases in third world country. Waterborne transmission is very rare in the first world countries such as the United States. Foodborne transmission, when the disease-carrying organism gets on the food and then the food is served to you and then you consume it by consuming the food, such as when a worker is sick, they handle your food, and then then you eat the food and come down with the illness. This is why in the foodborne industry, people who are handling food or serving food are not supposed to be sick, and they're supposed to be given time off without pay if they are ill, because of the problem with spreading foodborne transmission. Foodborne transmission can also be spread by undercooked or poorly stored or poorly handled food. Airborne transmission is a vehicle transmission, and that is when a person coughs or sneezes and you get it from over 1 meter. I don't like this, and I won't quiz you on it because droplet transmission is 1 meter spread. Indirect transmission is when the cough or the sneeze, and you pick it up from greater than 1 meter. To me, that line is sort of arbitrary, and so I'm not going to quiz you on airborne transmission just because the separation, or droplet transmission, because the separation is a little arbitrary. Any question about any of that? Oh, I thought I ended that. There's also vector transmission, where an animal carries the disease-carrying organism to a host. The most important group of vectors are the biting arthropods, especially fleas, ticks, and mosquitoes. There are 2 types of vector transmission. There's mechanical transmission, where the vector transmits the disease-carrying organisms passively, like this fly is passively picking up the disease-carrying organism from its feet, and then the fly carries the disease-carrying organism to the food, and then the patient eats the food, and then the patient comes down with the disease. That's mechanical transmission. There's also biological transmission. Biological transmission is when the pathogen reproduces inside the vector. So, for example, with malaria, the mosquito picks up the malaria, and the malaria actually reproduces within the mosquito. The mosquito then bites the human, spreading malaria to the human, and that would be biological transmission. Any questions about any of that? All right, we're out of time, and I will try and pick up next time from here. Are there any questions?
I just had a question about last Tuesday's video that covered the last part of chapter 8. Are you going to post that on the YouTube site?
I haven't posted that yet.
Not that I saw this afternoon last time I looked.
All right, that was a mistake. Let me look into that right now. There. Yep, I haven't posted that because I haven't changed the name. All right, I'll get that up today. Thanks
you.
for the reminder.
Yeah.
All right. All right, if there's no questions, I'll see you next time. And I will be in the lab, but only for 15 minutes to answer questions. After that, I'll log out. All right. I'll see you.